Hey everybody, guess what? We are live. I'm here with Kimberly with HPIHair. How's it going this morning?
It's going terrific. How about you?
Not bad, not bad. A little rainy where I'm at right now, but
Right.
I think that's part of it right now. I feel like we've had rain almost every day.
Oh, I know. The spring has been somewhat challenging, even though the temps have been cool, which has been good, especially for those individuals who are still without electricity. I mean, you
Yeah,
can't seem to get a break sometimes.
I know. I know. It's been one thing after another.
That's right.
Um, let's talk about HPI here. Tell us about your role there.
So I am actually the founder and the managing director with HPI Hair Partners here in Nashville. And also we have a location, a part-time location, I should say, in the Williamson County area in Cool Springs.
And so you just told me that that location is reopening tomorrow.
Yes, though that location, we're involved and have occupancy with Dr. Jack Monaco, who is a hormone specialist there. And so his practice has been continuing to see essential need patients. And so his office has continued to be open, but we'll be able to start seeing our clients and our patients in person once again there in Cool Springs and Franklin.
So I feel like when we talk about hair loss, it's such a wide subject that either you know someone, it's happened to you, or at different phases of your life, you've had children. We've all experienced that when after you have a baby, that massive loss of hair and regrowth. So tell us about all the types of people that you treat.
So, Donna, great question. Hair loss is just such a complicated, complex topic. It just is so devastating for some individuals when they've lose their hair due to different forms of medical conditions, such as chemotherapy, which we're all very familiar with, all the way to just maybe a temporary session and time in our lives when we shed, such as after childbirth.
Mhm.
Another time when we see a tremendous amount of clients more in the stressful times of their lives, either graduating from college, moving into a role within their career, undergoing a stressful time with a divorce, a job change, and then certainly a pleasant and positive experience when you maybe have a new child. Our system changes, and either due to genetic predisposition, stress, or hormone fluctuation, right, which you have when you go undergo childbirth, we see differing forms of hair loss, and we see those in men, women, and also children when we're starting to see stressful times in individuals' lives.
Mhm.
HPI is fortunate enough to be able to really support all of those individuals with anyone who is actually starting to suffer with hair loss due to just early stages, right? To where you start to notice a little bit more hair on your pillow, or if you have long hair, or if you have dark hair, if you're a male in the shower. Typically, our shower walls are white. And so we start to see more of those little fine hairs, right, all over the shower. And so it causes us to be concerned. And that's a good thing, because many times when we can start treating individuals at an early stage of hair loss, we consider that our hair preservation platform. And so we can start really trying to figure out and understand, why would someone be losing hair at maybe an early age? It could very well be from a genetic predisposition. Maybe mom, dad, brother, sister, grandmother, grandfather has thinning hair. It could also be from a hormonal change in a teen's life. As they change and as they start to mature, we see hormones change. And so many times, if we can start individuals at a preservation treatment phase, we're extremely successful in a short period of time. Sometimes we'll see results within 30 to 60 days.
Oh wow, that fast.
Right, right. Because usually those individuals are very young. So once we can start stimulating the scalp and start them on just a very minimally basic treatment regimen, we start to see results, and they start to see a lot of results because their hair actually starts to feel better, look better, and they can truly see the results either when they're blow drying, or either friends might comment on how much better their hair looks. And that really makes a difference in someone's confidence.
Right. You mentioned that. I feel like hair is one of those visible things. Like we can all deal maybe with a few wrinkles, but sometimes your hair is something that people see first. So it's hard to deal with a hair loss, especially I feel like for women.
It is. And it's funny because so many times people will automatically go, oh, sure, I know somebody in my life. My brother's, he's real thin here, or my husband's really starting to thin in the crown. And I stop them and I'll say, yes, that's the hair loss that we're accustomed to. But sadly, that doesn't make those men feel any better, because even though they might know that they're genetically predisposed to that, they are very concerned about it. And many men kind of really have to deal with this quietly and on the QT. I mean, very seldom will they speak to anyone outside of maybe a very close friend, a spouse, a girlfriend, a wife.
Right.
On the flip side of that, though, females start to shed and thin, and they're not supposed to. So when someone might have a girlfriend who they notice that their hair looks thinner, or their girlfriend mentions, well, it doesn't really matter if I get my hair cut or not because it just doesn't grow anymore. There's more going on to that head of hair and not growing than just it being genetic. Many times there's other health issues that are underlying. And so it's real important for those females to really dig down deep and kind of do a deep dive into what's going on with their health, and if there's any other underlying issues that could need looking at and more exploration into.
Right. Let's talk about treatments because you mentioned let's first talk about a couple things you don't do. You told me you don't do extensions. That's not part of your treatment plan. Because
Right.
you mentioned earlier you're about restoration. So extensions is not necessarily restoration. And what was the other thing you told me you don't do?
So we do not have a transplant surgeon that is on site with us, but we work very closely with a transplant surgeon in Atlanta. And so we have our clients we schedule a video consultation with our clients with Dr. Ken Anderson. And we actually provide our office as the video chat, and we get the client prepped. And then we have the client then travel on to Atlanta. We either take them over, or we will then see them for pre-treatment before their transplant work, or we'll see them for post-treatment after their transplant surgery.
But you do have an array of other options for people who are looking for treatment. A couple of them I wasn't aware of. So let's talk about what you do offer.
Sure. So for those individuals who are really interested in starting to ramp up some additional new hair growth and are really starting to restore some hair that they've lost, in 2014 and early 2015, we brought in a combination procedure into HPI's clinic. And so we actually treat those individuals with platelet-rich plasma injections, then a series of scalp microneedling treatments, and then we follow with low-level laser treatment. We do that here in the clinic as a professional treatment, but we also send our clients home with a device so that they can follow up 3 to 4 times a week with treatment. And then our last step of that is teaching the client really hair and scalp, treatment 101, as we call it, because stimulating your own scalp and making sure that you're taking care of your growing hair and your scalp daily is going to also really intensify the opportunity to have more improvement with the hair growth sooner than later. So we really have a 4-part combination treatment process. And I have to tell you, we've just had so many wonderful opportunities of clients sending us testimonials and sharing with us how happy that they feel that with this complete treatment, they've seen such an improvement that they had not seen before with just siloed individual, say, one PRP treatment, or maybe just using a laser therapy device. Those don't always work in a single treatment option, but in a combination option, they work extremely well.
Yeah, you mentioned something to me as well. So PRP, the platelet treatment is something some people have received at a dermatologist, but you guys have, you're a little bit different. Tell us about that.
Well, so we're actually trained trichologists. And so trichology is strictly the study of hair and scalp conditions. And dermatologists, oh my gosh, they're such amazing individuals because they have to treat our entire skin, right? And so when we talk to them just specifically about hair loss, it's very difficult for them to be able to really put a finger exactly on maybe a genetic predisposition or an autoimmune condition that a trichologist or an endocrinologist might be able to point to a little bit sooner in that identification of what truly is going on with the hair loss from the beginning. And so we really encourage individuals who are seeing any type of hair loss or any type of early shedding, or that their hair has just stopped growing, to really dig into their own holistic health regime and let's look a little bit deeper into what's going on instead of just saying, well, I need a new shampoo or I need a new conditioner. Sometimes it just isn't deep enough on the surface.
Right. So tell me what it looks like. If someone's interested, what is their first step? Do you come in for a consultation? You mentioned that earlier. How does that work?
Right. So we actually offer 3 different forms of initial consultations. The first being we can actually have a telephone consultation. Many times that is challenging since we're actually needing a visual for someone. And then as of January, we launched our video consultation sessions. And we didn't know that COVID-19 was going to come into play, but boy, we were ever thankful for getting that going in January, to say the least. And so we've been seeing and keeping up with most of all of our clients and those who are looking and seeking for new treatment options through our video consultations over the last 6 weeks. And then certainly we love to see everyone in person, and we also offer in-person consultations as well.
Yeah, you have a lot of great options. So if someone is interested in coming to the Williamson County location, tell them how they can sign up and get more information.
Oh, certainly. Thank you. Yes. So we'll start our in-person visits there tomorrow. They can actually just go on our website and request a consultation from the website. They can pick up the phone and certainly they can call our main office, and the number there is 615-662-8722. And we centralize all of our phone calls because we have one centralized appointment schedule. So we're able to know where we need to be and what's going on at which location. And we're just hoping that we can certainly dive in and help more individuals after kind of being able to come out, if you will, and start to being in the real world and going out for dinner or for lunch or being able to get outside and feel good about how you look.
Right. Well, thank you so much. What's the website again? HPIHair?
HPIHairpartners.com.
HPIHairpartners.com. You guys go check that out. Thanks a lot, Kimberly. We will see you again soon.
Sounds great, Donna. Thanks so much. Have a great day. Bye-bye.